My name is Iskander. I graduated in 2003. My mom's a dentist. My wife's a periodontist. My dad's a retired dentist. My brother's a hygienist. Graduated and I joined my mom's practice. And I basically started by taking some implant courses and at a very fancy institution. And they recommended for me to come here. They said, you just gotta, if you're gonna do implants, you gotta know occlusion. If you're gonna know occlusion, you gotta learn it from Dawson. Crown and bridge, you cement a crown, and then there's a lot of occlusal adjustments and so on and so forth. And you realize, hopefully with the predictability of the Dawson philosophy or complete dentistry, there's a whole lot less of that, that's for sure. Complete dentistry is just completely different from usual and customary dentistry. And when you see the usual and customary dentistry, and then you see, everything is an aha moment. You learn a lot about occlusion in dental school. You just don't know what it is until you come here. And you can't really do dentistry without it. Just you have a more thorough, complete understanding of what's going on in the mouth, and you certainly can avoid some troubles that you just didn't know were there before taking these courses. I actually have a dozen friends that are dentists, and I've been speaking to them to come here. And a lot of them feel it's a lot of extra work. My opinion, or what I've told them many times, is that you can't avoid this. At one point or another, you're gonna learn it the hard way, learn it the easy way. This stuff is just unavoidable. And that's the advice I give them. And it does save you time, it does save you trouble, a lot of trouble. I was doing a hygiene check on a child, and the child had a bit of a tongue thrust. So I looked at its tonsils, and I told the parents, well, he's got a tongue thrust, that can affect his occlusion. Why don't we have the family doctor look at his tonsils? And that completely wowed the parents. And I was the first patient Monday morning, right after a class. And that's when I realized, wait a minute, that thorough understanding is gonna help you and the patients quite a bit. I would do it again, any day of the week, anytime. I'd actually likely be here again for a future course.